Hello, and we will discuss the fixed appliances and their techniques. Fixed appliances are indicated when multiple tooth movements are required, such as rotation, bodily movement, derotation, and controlling space closure. In these appliances, we can do multiple tooth movements at the same time, and it requires less patient skill because the bases are fixed. The appliances are divided into active components and passive components. The active components, they are the separators, arch wire, springs, and the elastics. For the passive, we have the brackets and the ligatures that we use to secure the bracket to the wire. The first active component is the separator, which is used to create space between two adjacent teeth. There are several types. We have the ring elastic separator, and it shows patient compatibility and feels comfortable using it. The second is the dumbbell shaped separator, and it is attached in the buccal palatal direction. It requires 4 days to get the appropriate separation before starting adding the bracket. The third type is the brass wire separator. It uses 0.5 or 0.6 millimeter of soft brass wire that it is passed around the contact, and the ends are twisted tightly together like this image. It's a problem that it may cause soft tissue damage and poor patient acceptance. The arch wires is the second active component in the orthodontic appliance. It gives the movement that we want, whether it is tipping, the bodily, the torque, the rotational, and the vertical movements. It can be welded or it can be bonded, and it is classified according to the material that is made of. It can be gold, stainless steel, nickel titanium, cobalt, and an optic flex wire. The stainless steel has an adequate strength to cause force on the tooth, but it lacks elasticity to make the appropriate and flexible bending that we need sometimes. On the other hand, the nickel titanium is more flexible, but the wires cannot be welded or soldered, so it cannot receive bends or loops or helices. The OptiFlex is made of clear optical fibers, although it is highly aesthetic, but the arch wire cannot receive sharp bends. Especially if this was used with ceramic brackets, it will be so aesthetic, but the brackets have the capability to get teared off and broken easily. Let's see what are the different springs that can be used in fixed appliances. And a spring is an active component that can do uprighting, torquing, rotating, and opening or closing. The uprighting spring is this one. It is fabricated with these dimensions of and it moves the tooth roots in a mesial direction in order to upright the tooth. This is another image of the uprighting spring. It moves the root mesially to upright the tooth. The second one is the torque spring. It makes from its name a torque movement to the root. The third one is the rotating spring, and it is used to derotate the rotated teeth, and it is made of stainless steel or nickel titanium. This is it. The open coil spring, it can also be made of stainless steel or nickel titanium, and it is used to open up spaces between the teeth. On the contrary, the closed coil springs is used to close the spaces between the teeth. Now let's talk about the elastics. They are made of latex or non-latex material, and they are capable of doing many types of tooth movement. They can be used to close the spaces, correct open bites or cross bites, and the molar relationship can be corrected using the elastics. Also, they are named according to the class that they fixed. For example, the class 1 elastics is stretched between the molars and anteriors in the same arch, and it is used to close the spaces and do retraction of the anterior teeth. So it is used to correct the spacing or crowding in the class 1 malocclusion. The second elastic type is the class 2 elastic, and it is used to treat the class 2 malocclusion, where we have proclination of the anteriors, so we need to make retraction by putting the elastics in the between the mandibular molars and the maxillary anteriors. This is another way of using the elastics, is to treat the crossbite. In this case, what we do is we put one side in the palatal surface of the maxillary molars or premolars, and the other side is on the buccal surface of the mandibular molars or premolars, or vice versa, and this will bring the arches to their appropriate occlusion and will treat or correct the crossbite. Here in class 3 malocclusion, where we have a proclination of the mandibular arch, we can use the elastics to retract the mandibular incisors by putting the elastic between the maxillary molars and the mandibular incisors. Also, it can be used bilaterally to close the open bites, and here it is used to correct the middle shift of the midline deviation. So it is placed across the maxillary and mandibular anteriors. Triangular elastics are used for the extrusion. We have discussed the active components that were the elastics, then the wire, then the springs, after that the spacer. Now we will talk about the bracket. Bracket is a passive component that transfers the tooth moving forces from the arch wires and other components to the teeth, and it can be welded, which is somewhat old, or it is bonded. The brackets can be made of stainless steel or a metal, or which is the most popular and most efficient of the other types. The other one is the plastic bracket. It is fragile and it can detach easily. We have the ceramic brackets that also can get broken. These are the weldable brackets, and these are the bonded brackets, which are the most popular. Now let's have a brief view on what are the steps of attaching the brackets. First, we scale the tooth and do the polishing to get a smooth surface using the rubber cup and the prophylactic paste. Second, we do an phosphoric acid etching using 35% concentration. Then we dry the surface and see the demineralization of the enamel. Then we apply bond and we cure it. Then we apply a flowable composite on the concave side of the bracket, and we start aligning it on the teeth. The alignment should be, if we took a line from vertically and horizontally, the intersection of these both lines is where the bracket should be placed. After placement, initial placement, we do an initial curing. Then we remove any residuals, and we see if there is any need to do a correction of the placement, and we do the final curing before placing the wire. And this is the dimensions on where to, the exact places where we should cement the bracket. For example, the central incisors, it should be 3.5 millimeter from the incisal edge. The first premolar also 3.5 millimeter from the buccal cusp tip, and so on for the maxillary and the mandibular arch. For bracket positioning, we can use some instruments that can help us to get an accurate results. The first is the Bohn's gauge, and it measures the height of the teeth and help in the proper positioning. It has the 4 measurements that we said: 3.5, the 4, the 4.5, and the 5. The other one is the bracket positioning height gauge, and it is close to it. This is the Bohn's gauge. It must be placed perpendicular to the tooth axis, and this to measure the height and put the bracket in the appropriate place. This is the bracket positioning gauge that has these the height. This the width is the height, and this width is 3.5, this is 5, and this is 4. This width. In some cases where we need to put the brackets lingually, for example, in some cases where we have an abnormal tongue habits, or the aesthetic is so important, or it is more used in the lower arch. We do what is called the indirect bonding, and it is a procedure of bonding the brackets on the study model. Then we do an impression using an resin, a transparent material. After that, we heat, vaporize this material by adding on it the material that we used for the night guards. Then we soak it in water for 1 day until it is detached. We clean the internal surface and we send it to the dentition. The dentition do the same steps that we said in the direct bonding of scaling, cleaning, polishing, and bonding, curing. Then they add the bracket with the that they are placed inside the tray, and when they are fixed probably inside the mouth, they should have first put the flowable composite inside the tray before inserting it into the mouth. When proper alignment is achieved, the dentition starts to cure the material since it is transparent. After that, the dentition removes the tray and removes any residual resin and cure the brackets to ensure proper attachment. If you want more details, you can search this topic on YouTube to see the steps step by step. This is what is called the indirect bonding. This is the lingual appliance.